Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, the ROI on employees' health and well-being. I speak with Ron Goetzel, Director of the Institute for Health and Productivity Studies at the Johns Hopkins Bloomberg School of Public Health, about how a workplace's culture can help employees feel safe, valued, and healthy, and why it's well worth the investment. We'll also talk about some tools and resources for employers to evaluate how well they're doing and how they can shore up supports for staff in all kinds of workplaces. Let's listen. Ron Goetzel, thank you so much for being on Public Health on Call. It's good to have you.
Thanks for inviting me, Lindsay. Pleasure to be here.
So you're an expert in health and productivity management. Tell us, what does that entail?
Well, it's interesting. It's actually a very unique aspect of public health, which is a collaboration between the business community and the public health community. And the reason that's important is think about the 160 million or so Americans who go to work every day, and they spend the majority of their waking hours at work, and contrast that with how often you visit your doctor or other healthcare provider or interact with the public health community. And usually it's in response to a crisis as opposed to public health, things that you need to do and the community needs to do to keep you healthy. So in short, Americans really don't want to have more expensive healthcare in their lives. They want to live a healthy and productive life full of meaning, joy, freedom to enjoy their pleasures, get together with family. And not surprisingly, the employer community, the business community wants the same thing. They want employees to be healthy, productive, and that means not just not being sick. It means the ability to do pleasurable things, even fun activities, family and friends, and to be focused on work when they're at work.
What are some programs or initiatives you've seen that bridge this holistic look at employees?
Well, first of all, you've got to preface it by saying that it's not necessarily just a program, it's a culture that evolves in a workplace. And that usually starts at the top with leadership, senior leadership and middle management. And they have the authority and power to provide that kind of culture with funding, with strategic planning, with programs and environmental supports, and most importantly, measurement and evaluation, which means that not only do you put these things in place, but you also track and monitor whether they're actually delivering value. So for employers, for example, what's important is obviously showing up for work, but not only showing up, but also having the energy, not worrying about your family's health, being engaged and feeling proud about the job you're doing, avoiding accidents because you don't have enough sleep or you don't eat the right food or you don't get enough exercise. But importantly, also, you want to have a clear line between work and home life and start enjoying work and home life at the same time. So the kinds of programs that work, and we've done a number of best practice and benchmarking studies, fall into three broad categories. One is the psychosocial element. The second is the organizational element. And the third is the environmental element. And I can tell you a little bit more about each if you're interested.
Let's go there. Yeah.
All right. Well, in terms of psychosocial, so these are things that you essentially control, things that you have power over by and large. So, for example, eating healthy, getting enough physical activity, not smoking, not drinking excessively, not using drugs illicitly, driving safely, having regular preventive exams with your doctor. All of this is important for you to be fit physically. So the organization can support all that. So, for example, they can provide healthy food in cafeterias and vending machines. They can provide access to fitness centers. They can have ergonomic workstations, no smoking policies, benefit coverage, insurance coverage for screening, preventive exams, access to medication and services at low or no cost. So these are things that are organizationally effective. And then on the environmental side, they want to protect you from toxins, from hazards That obviously includes COVID-19 and virus and so forth. But it also includes other elements of the physical space, healthy air, healthy water, not being too hot, not being too cold, having sufficient light, the physical space being designed in a way that allows you to focus and concentrate, but also socialize with other people in the workplace.
So a lot of the things that you've talked about here are, I think, what I would associate more with like an office type setting. What about workplaces that maybe they're smaller and they don't have as many resources to be able to provide these kind of things to their employees, or even workplaces that might have some sort of risk associated with them? What can they do?
Well, obviously they can follow guidelines, and we've put in place actually a whole series of different scorecards that employers can take to decide whether they have a healthy company culture or not. One of the ones that is most popular, and that's one we developed with the Centers for Disease Control and Prevention, is called the CDC Worksite Health Scorecard, and has 18 modules in it, anywhere from social organizational support efforts, stress management, depression management, blood pressure screening, ergonomics, all those factors. Quite honestly, a lot of them don't cost a whole lot of money. It's just a matter of changing policies in the workplace and making sure that everybody's aware of those policies so that they are reassured that they can lead a healthy lifestyle. So, for example, we want you to eat healthy. We want you to manage your blood pressure, cholesterol, glucose, get screened. And we'll provide you with the benefit structures and support systems to do that. We want to make sure you don't spill over your work life into your home life, you get enough sleep. A lot of this are things that are supported by the organization and provide a safe environment where you can practice what you preach essentially, and also at the same time, make sure that your workers are healthy and committed and motivated to align with the company's mission.
This is a really interesting time to have this conversation because we're coming out of the pandemic, which really just upended all kinds of workplaces, whether you were an essential worker that was required to show up and be there, or you were someone that was working from home and maybe all of a sudden your work and home life completely bled together and you couldn't differentiate them. What are some of the things that you've seen that have changed, or what are some of the things that people are really intensely looking at now that are studying this field?
Yeah, I mean, first off, I think the COVID-19 pandemic made business leaders aware of the connection between population health and the economy and their business performance. People didn't come to work because they were sick from COVID. They didn't want to infect other people. They didn't want to get infected themselves. At the time that it began in 2020, there were no defenses really for the disease. So people stayed home, the economy cratered. The employer then asked public health officials, what can we do? What can we do to avert this crisis moving forward? And we actually published a report that was sponsored by the Beaumont Foundation, which talked about 7 ways in which employers can support their workers through this kind of crisis. Number one, of course, is listen to expert advice. And that obviously came from the communities such as public health communities and governmental agencies like the CDC. But secondly, make sure your workers are healthy, and not only healthy physically, but healthy mentally and socially and financially, because many people were suffering. They weren't getting wages at the time. They weren't able to provide childcare services. And all of these things really mattered to get people through this COVID pandemic. Most importantly, I think mental health and stress emerged as a common problem. So it was no longer a diagnosable issue. It was really something that every one of us faced and had to deal with on a daily basis. People became much more open about their mental health issues and their crises and their family crises. And that basically made employers aware that your employees are more than just cogs in a wheel here. They're actually humans, capital assets that you really have to manage and take care of.
That's a really good point there, because when we started the conversation, you talked about this being a top-down cultural shift. How can employees advocate for their own well-being in the workplace?
Well, certainly they should let their managers know that their health and well-being is important to them, that it's really part of who they are when they come to work every day. And it's not just about physical health, it's also their mental, social, financial, intellectual, career health, and even in some cases, spiritual health, having purpose and meaning to their work. All of those are important to them. They shouldn't just be offered a treadmill or a weight room to take care of their health. There has to be much more to that. And they can form social relations to various employee resource groups, have well-being champions in the organization. They want to be part of a committee that potentially improves the health and well-being of the employee population. They can ask for a budget, for real influence on recommendations, have leadership sponsorship. Those kinds of things are important to them. And again, in order to make sure that all of this really matters and really works, you've got to measure and evaluate it over time and provide feedback on things that are working versus those that are not.
And you mentioned the report card that employers can utilize, and we can link to that in the summary for this show. But what are some other resources for employers that are interested in investing in the well-being of their employees?
Well, one of the things that we've started as a result of this, and this goes back a few years, we began it at Johns Hopkins, is something called the Mattingly Award. The Mattingly Award is given to organizations and employers that have executed exemplary best practice tools and services and programs and cultures that support the mental health and well-being of their organizations. And we've actually set aside 10 criteria for winning the award. And those organizations that satisfy those criteria, that are doing the things that are on the checklist, those are the ones that will earn recognition for their efforts. So that's also a good scorecard that employers can use to improve their health and well-being in the organization. But there are other tools out there. There are reports, there are guidebooks, there are other things that are available on our website at Johns Hopkins, the Institute for Health and Productivity Studies, and also on the Love You Project website, which we have aligned with, that gives the Mattingly Awards.
And I want to ask you actually about the Love You Project. Could you talk to us a little bit about that?
Right. The Love You Project started tragically with the death of Richard Mattingly's wife by an employee at his organization, which was Cystic Fibrosis Foundation. Unfortunately, it was one of these situations where the employee had to be fired, and he took out his rage at Rich Mattingly, who was CEO at the time, and his wife. Instead of basically moaning and groaning and having a terrible life thereafter, Rich Mattingly decided to form a foundation that would focus on achieving mental health in the workplace. And that's how the Love You Project started. He also decided to align himself with Johns Hopkins University and our Department of Mental Health, and now most recently, the Post Center for Workplace Mental Health, POST standing for Psychosocial, Organizational, and Environmental Factors that cause mental health problems and stress, but also offer solutions in those categories. And out of all of this, and we've been working together for many years now, we're now having a summit at the end of June, June 27th at Johns Hopkins, where we're bringing together thought leaders, subject matter experts who can talk about what the evidence base is all about, what they can do, how they can manage and improve mental health in the workplace.
Well, the center and I know the school are certainly aiming to be leaders in this space and to really drive this conversation forward. What do you hope to see?
I hope to see many more employers adopting best practices. Many employers don't realize that their actions, that their policies, that their statements, how they work things actually influence the mental health and well-being of their workers. And this is especially important right now as we have a labor shortage. Employers are struggling to find talented people to come work for them. And especially young workers, the millennials and generations X, Y, and Z and so forth, are looking for places to work that are more than just a 9-to-5 paycheck, but a place that they can connect to other people, a place where they can have fun, have purpose, have meaning in their lives, and also feel supported for their efforts by their employer. And so we're hoping that many, many more employers adopt these best practices, adopt these programs, and provide a positive organizational support experience for their workers so that they get more out of them instead of workers deciding every 6 months, this is not for me, I'm going to go somewhere else.
Well, Ron, thank you so much. I feel like you have demystified a lot of this, and I know that there are tons of resources available, and we will send people in your direction for more. Thank you so much for your time.
You're quite welcome, Lindsay. Thank you so much for the opportunity.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.